Okay, good morning. So today we will finish up lecture two, and then we're gonna go and start on lecture three. I will try to wrap things up a little bit earlier today, so you have time to study or go do the quiz. Um, but we'll see. Now I want to start by writing a note for you. Okay, so this is the lymphatic system. And cardiovascular system. Okay. I want to show you how the two are related to each other. And part of the drawing is going to be familiar to you because we've learned it already in lecture one. So it's going to be a good review for you, for the quiz. But it's a big diagram, so if you have a piece of paper, turn it sideways, start a new piece. Okay, I would recommend. So I will start by drawing here, and then I'm gonna draw here, 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 and then eventually I'm gonna draw more stuff here. Okay, so spread it out throughout the paper. So starting on the top left of the paper, I'm gonna draw this thing, which is something that we did previously. Okay, so this here, let's just leave it open for now. We're gonna have extended later on. Okay, but this would be a capillary blood vessel. Okay, and we know from the beginning of this lesson that the blood has two portions, right? I mean, they're not separated like the way I'm drawing it right now, but I want to draw it separately to help you remember it. Okay, so again, if you have color or highlighter, it would be best. If you haven't got any colors yet, I strongly recommend you get some because we will be doing a lot of coloring starting unit 2. Okay. So this yellow stuff is the plasma, right? Plasma, which, as you know, is the fluid portion of blood. Mostly water, right? It makes up about 55% of blood. Here, I'll put the 55% here. Okay, so we know that already. Mostly water plus some nutrients and other stuff. Dot, 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 dot. And you can fill that in later. Now, in the plasma, we have other things like red cells. Okay, so RBC. You might have some, I mean, you will have some white cells. Okay, white cells, you can draw them like, with a little clover leaf in the middle, WBC. And sure, you will have some, maybe platelets as well, which are like tiny fragments, right, of cells. All right. So this is the arterial end. And then on the other side will be the venous end, which I'll label later. But nothing's new. Everything we learned about already, right? Okay, you're gonna hate me for this, but I'm gonna move this. I'm gonna move this thing down a little bit, so I have more space. And then I'm gonna move this up. Sorry, you don't have to do anything. It's just like, I'm just trying to make more space for me. Okay, like that. There we go. Okay, so that's the plasma portion of the blood. Okay. So I'll give you a moment to catch up. and then I'll fill in more information with you. Okay, and feel free to take this time to ask questions if you have any.
Sir,
Yep.
do we get 2 chances at the quiz?
Oh no, the quiz is only one chance. Yeah, one chance. It's the lab quiz that you will have 2 chances for.
Okay.
Yeah.
Excuse me, sir. The lab quiz, is it like the normal quiz?
Yeah, the lab quiz is like a normal quiz, but it's based on the lab, right? The PowerPoint and the models, and those are only 2.5%.
Like, we have to watch videos and all.
No videos. I'll talk about the lab again when we get closer to it. Okay. Maybe I'll tell you about it on maybe Wednesday. Just focus on the quiz for now. Okay.
Okay.
All right. So we also learned that on the arterial side we have blood pressure, right? So this arrow represents blood pressure. And then on the venous side, we also have blood pressure, but to a lesser extent, right? Okay, so BP here is greater than osmotic pressure, which is going to be pointing the other way. Okay. And over here, the osmotic pressure does not change compared to the arterial side. So on the venous side, the BP is less than OP, right? Okay. Green arrow is the OP. Red arrow is the BP. Again, this is old stuff. You know this already. But there is more to the story. Okay. That's why we have to redraw some of these things. Okay. To try to make the arrows the same, okay? For the green one. It's the same arrow. Okay? Same length. I know it doesn't really look like it, but so what's going to happen on the arterial side? You will have net loss of fluid, right? And then over here, you would have net gain of fluid. But at the time, I was telling you that the blood pressure is about 30 mmHg here. But over here is only 15, right? Roughly. And then for the osmotic pressure, if you have been studying, you would remember this is about 20 mmHg. Right? 20 mmHg. So if you do the difference between 30 and 20, it's 10. But on the venous side, the difference between 15 and 20 is only 5, which means you are losing more fluid than you are able to bring in, right? You're bringing things in, but not all of it. That's the problem, right? So that's where we left off last time. When we learned this in lecture 1. The question now is what happens to the excess fluid? Okay, so we're gonna draw some cells in the tissue out here. Okay, so you can draw some cells. They're just like little sunny side up eggs, if you would. There you go. Okay, just draw some of them. Okay, let's do another row. Right, so these are cells in the tissue. Now, there are some space between the cells and then the fluid that is leaking out of the capillary, they're going to fill up this space. Okay, so some of it will go back to the venous side of the blood vessels, but not all of it, right? So these fluid that are between the cells, it's very similar to the plasma because it's derived from the plasma. Okay, there's no cells though, of course. So these are what we call the interstitial fluid. Okay. Okay. They are derived. Derived means it came from plasma, and they are fluid between tissue cells. All right. Now the thing I've been trying to tell you is, you end up losing more fluid from the arterial side than you are able to bring in a venous side. So the extra fluid is gonna need a separate pathway to be drained. Otherwise, you will end up having too much interstitial fluid, and then the tissue is gonna start to swell. Right? We call that edema. EDEMA, right? Show you a picture of what that looks like later on. So, the drainage pipe is another kind of vessel, okay, like this. Okay, so this here is called a lymphatic vessel. Lymphatic capillary in this case, okay, because it's really, really small. They can become bigger later, and then we'll call it a lymphatic vessel. But they are typically next to capillary beds, very close proximity. And the purpose of the lymphatic capillary is to take some of these excess fluid, okay, and then it will drain it. Okay, so it will help drain excess fluid from tissue. Okay. But once it is in the vessels, let me see if I can choose a lighter color. Once it is in the vessel, in the lymphatic vessel, the fluid goes by a different name. Okay. We call these lymph now. Okay, so that's the let me try to fix this up a little bit. Okay, the lymphatic capillary is the tube, and then the fluid that's inside, that's called the lymph. Okay, fluid inside lymphatic capillaries. All right. Now I'm going to zoom out a little bit just for you to see the whole situation. Well, part of it anyways. Does anybody have any question for me before I complete the story?
There is a down arrow. Where is that fluid coming from?
Say that one more time, please.
There is an arrow at the bottom of the lymphatic capillary.
There is an arrow. This arrow? This arrow?
Yeah.
Oh no, that's just pointing at it. Okay,
Oh,
let me-
okay.
yeah. Let me maybe I'll just use a black arrow. So the lymphatic capillary is like this structure, right?
Excuse me, where does go lymphatic capillary?
Where does this go?
Yeah.
Yeah, I'll show you. Yeah, I'll show you. I just want to make sure that everybody's okay with what's on the screen before we finish the story. Good question, though. Okay. Well, this is not the only lymphatic capillary, right? You would have another lymphatic capillary coming from another part of the body carrying the lymph. And then you would have like maybe another one here. Okay, so these are basically lymphatic vessels from all over the body, and then they come together, they converge. Okay, they come together at a specific point. Okay, and it forms like a big knob in the body. Okay, and you can color the green later. Okay, like I don't, you know what? Let's just do it. Doesn't really take too much time, I suppose. Okay, so like it take all the lymph from different parts of the body. Okay, and then it will go to this place here. Okay, so this place is a lymph node, which you might have heard of, right? So like, you know, go to a doctor when you're not well, they might feel your lymph node in the neck, right? To see if they are swollen or not. Does anybody know another place in the body that have lymph node? These are not the only place, right? You have big lymph node clusters throughout the body. Besides the neck, anywhere else?
I know in younger children, they have them behind their heads.
Yeah.
Like lower.
Yeah, like around this area, yeah. But anywhere else in the body, adults?
Under your arms?
Yeah, armpit right here, right? So there. Right. Legs, right? Groin area. Right? All those places have lymph nodes. And in the lymph node, you will have some white cells. Okay, you're gonna have some white cells there. Okay. They live there, okay? WBC. And they're gonna check the lymph. Make sure it's clean. Make sure there's nothing weird going on in the lymph. Okay, and then it will let it pass. So let's finish up the diagram and I'll tell you more. Okay, so let's extend this. This is still the blood vessel. Venous side. And the lymph is gonna reconnect. Okay, and then let it go back to the blood. Okay. Wrong arrow. There we go. And then it becomes the plasma again. Okay. Now I let you copy first, and then I'll simplify this for you with another flow chart. Hopefully, it will make it easier for you to understand. All right. So just separately here, I want to help you see this. Okay. So we have the I guess I'll just put it down here. Okay. So we have the plasma, right? Plasma is inside the blood vessel. And then it's gonna leak out. And when it's between the cells, we call it interstitial fluid, right? Some of it will go back here, right? Through the venous return, like on the venous side, I'm sorry, on the venous side of the blood vessel. It would just get taken back in directly, right? but some will go into the lymphatic vessels where they will become lymph. And then the lymph will get returned to the plasma as well. Okay, so that's basically how they're all connected. Okay, so the content of the plasma, of the interstitial fluid, and of the lymph, it's similar. Okay, similar. Think of it as like, you know, cake, muffin, right? And you know, pancakes, right? They all make up of the same stuff, pretty much, right? But different proportion, right? Different ratio. Very similar concept here, right? They're mostly water. The ion composition might change a little bit, right? Here and there, but it's pretty much very similar. Okay. Does anybody have any question? Before I tell you one last thing about this epic picture. So you might wonder, like, what's the point of doing this, right? Why so complicated, have so many, you know, draining system and so on and so forth, right? Don't draw this next part. Just watch and listen. I don't want you to ruin your diagram. So let's say you have like some kind of injury, right? Like a thumbtack or something, right? Favorite kind of injury to draw. And then let's say this was like a dirty thing, like a dirty thumbtack or something. Okay, and then it introduced some bacteria into your system. Okay, like these are bacteria. Again, you don't have to draw this, you just watch. So what happens is there are these like bacterial products that are in your body now. Okay, which may come out in the interstitial fluid as well. Right? Or it doesn't have to be in the blood, right? Like you could just have the injury directly in the tissue, and then you will have these bacterial product in the interstitial fluid, which would then get carried through the lymph to your lymph node, right? So when the white blood cells in the lymph node detect these bacteria or parts of a bacteria, right, they will get activated, and then they will divide and make more white cells. And it is this activity in the lymph node that caused the lymph node to swell up when you're fighting an infection. Right? That's why it's like tender and it hurts a little bit. It's the activity of white cells trying to get rid of these bacteria. Right? So this actually is a surveillance tool to monitor if there is anything foreign in your body. Okay? Whether it's in the interstitial fluid or worse, it's in the blood. It's really bad if it's in the blood. Okay, because it just gets like all over the body, and you know, it could cause like what's called sepsis. The person could die very easily. But you know, if it's in the tissue, it's more localized, right? So that's the relationship between the cardiovascular system and the lymphatic system. Okay, that's part of the lymphatic system anyways. Okay. Now, if you don't have questions, I am going to switch to the study guide, which
I have a
is
question, Professor.
yes,
The
yeah.
bacteria cannot go from the tissue to the blood?
Normally not. Normally they are very localized, and as you will see today, your body will clear it, you know, quite quickly. And if it fails, then it's possible for the bacteria to go into the blood, and that could cause like serious problem, right? It's called bacteremia. Okay, anytime you have like remia, it means it's in the blood. So this is like bacteria in the blood, which could lead to sepsis. Okay, and that is a life-threatening situation. Okay, so, but you know, typically you can keep it fairly contained in the tissue. So this is lecture 2. I want you to go to this diagram. We'll label it together. Okay. So like I said, it's important to either have digital copies of these where you can scribble on, you know,
Hello?
or print it out as well. Sorry, yeah, you have another question, Mohammed?
ठीक है.
So, let's take a look at this picture. This is all the structures in the that are related to the lymphatic system. Let's label it first, and then I will go back to the PowerPoint and tell you more about it. Okay. So, at the back of the throat, as well as the back of your nose, you have these lymphatic tissue called tonsils. Okay, tonsils. And like I said, you have some at the back of the throat as well. In fact, if you go into the mirror and you say ah, right, you can see two like a pair of tonsils. Okay, some are very difficult to see, like they are like really hidden away. You won't be able to see it yourself. But that's what the doctor is looking at, right? When they stick the popsicle stick in your mouth and tell you to go ah, they are looking at tonsils. Tonsils contains a lot of white cells in it, and much like lymph nodes, the white cells would detect bacteria and pathogens, and they would divide and have all these cellular activity when you have an infection, and that's how it gets swollen. Okay. Like I will have notes for you later on, okay, in the PowerPoints. Like right now, I just want to label it for you. Okay, there is the thing right here that is in front of the heart. That's the heart. Okay, anybody know what that is called? Is that the one they remove for some baby? Are you talking about the one I color, or are you talking about the tonsil? Oh, yeah, not just baby, like adults. Some adults can have their tonsil removed as well. Okay. Some people have these. They call it rocks. Okay, that grows in the tonsil and it hurts when you swallow. The rocks is basically calcium deposit, and you know, they have their tonsils removed. You're fine without your tonsils. Like I mean, like you might get more susceptible to infection, but like as a person, like you're for the most part fine. Hey, what's this thing? Anybody know? No guesses either? That's all right. This is the thymus. Okay, the thymus. Remember the T cells that we learned last week? Okay, you have lymphocytes, right? There are T cells and B cells, right? The T cells are the ones that helps you coordinate an immune attack. That's where they get their name from. Okay, so T cells matures here at the thymus. Do not confuse the thymus with the thyroid. Okay? Thyroid is the one that gets big when, say, you don't have enough iodine. Thymus is a lymphatic organ where the T cells matures and gets activated. Okay, more on that in the PowerPoint later. How about this little guy? What is this? That's terrible coloring job. What is this? This is behind your stomach, very small.
Spleen?
Very good. That's the spleen. Okay, so spleen, again, like the tonsil, like the thymus, they have a bunch of white cells in there that helps you screen for pathogens. But spleen also helps you store a little bit of blood. Okay, so if you're bleeding out, you know, to maintain blood pressure, the spleen can squeeze out some blood for you. You can also live without your spleen. Splenectomy. That's when you remove your spleen. Okay. All these lines here, I'm not going to color all of them, but those are going to be your lymphatic vessels. Okay, so you have some major ones that are going, throughout the body. They have names, so I'm just gonna call it lymphatic vessels. Okay. And over here, this is pointing at like the bulges if you look closely. So that's like the lymph node. Okay, there's another lymph node right here at the neck. Right? Okay, so moving down, over here, we have a bit of the bone marrow. Okay, so bone marrow, of course, is part of your lymphatic system because that's where new WBC are produced. Okay. More lymphatic vessel here. They are almost as extensive as the blood vessels, right? Whenever you have the capillaries, you're gonna have the blood vessel. You're gonna have the lymphatic vessels kind of next to it. Okay, so what we did here is they took a lymph node and then they magnify it. Okay, so this whole thing is a lymph node. Okay, and then they are focusing on like a small part of it. Okay, like they're zooming into the lymph node. Okay, so I'm gonna do that. I'm gonna zoom in here and oops, not sure what happened. Let me try that one more time. Totally lost it now. Give me a second. Oh, there it is. Okay, is it? There we go. Now, hopefully you have some colors for this, okay? Otherwise, it's very difficult for you to see. All right. So here we have the blood vessels. Oh, I just realized I forgot to tell you something important. Okay, hold on. I'll tell you afterwards. So that's the blood vessel. Right? You can color it. Okay. Let's label it as well. Over here, that is the blood vessel. Right? More correctly, at this level, because it's so small, it's more like capillary, right? And you see, these are cells. These are red blood cells, basically, right? The red blood cells are inside the blood vessels, but then we also have cells that are outside. Right? So that would be the tissue cell. Right? Pretty much like our drawing, right? That's the tissue cell. Right? That's another tissue cell. And I was telling you that there are fluid between the cells in the tissue, right? So there we go. I'm only going to color this section. You can color the rest later. And that tissue fluid is called interstitial. Interstitial fluid. Okay? And they are the ones that are leaking out from the blood vessels. And there's only one thing left to color here, which is this big thing. And someone tell me what that is? What should I label that one as?
Wait,
Not quite the vein. I know why you would
lymphatic
say,
vessel?
yeah, that is the lymphatic vessel. Lymphatic vessel. Now, the thing I forgot to tell you about is that lymphatic vessels, because they don't have a pump like the blood vessels do, that's why they have these valves. Okay. Valves. Well, this is a valve. Okay. A valve in the lymphatic vessel. And the reason why we need that is because the flow of lymph is quite slow because of a lack of a pumping system. It doesn't have a heart that circulates the lymph. And so by having these valve, you prevent the lymph from backing up and pooling. Okay, it's always moving forwards. It functions as like the heart valves. Okay, it prevents the backflow of, in this case, lymph. Okay, prevents pooling and backflow of lymph. All right, so there you have it. That is the whole diagram. Let me know if you need clarification on anything.
I have a question.
Yep.
So for the lymph nodes, to me, they're looking similar to like the veins in your arm. So if like a nurse were to start an IV, could she like accidentally hit like a lymph node by accident and not a vein, or is it
Yeah,
deeper?
that is a good question. Yeah, no. The veins, like in terms of size comparison, is much bigger than the lymphatic vessels. And besides, you can see the veins, right? The veins are much more superficial. The blue lines that you see on your arms, for example, those are the veins, right? So you're very unlikely to poke through one of these things. Yeah.
Can you explain the T cells a little bit more, please?
Say that one more time. Can I
The
explain?
T cells.
The T cells? Yeah, so we're gonna learn a lot more about T cells in lecture 3, but for now, remember the note we took last time? Maybe let me see, where is it? I don't even, was it the 15, I guess? Okay, like here, right? White blood cells, they have agranulocytes, which one of the types is lymphocytes, right? So a type of lymphocytes is called T cells. They are made in the bone marrow, as with all other white cells they are. And then they will migrate to the thymus, and in the thymus they will mature. And what does maturing means? I will show you in the PowerPoint. Okay. So that is that for now. Let me go to the PowerPoint here. Okay, so that's basically all the lymphatic structure. There is the appendix here that I didn't talk about, but there's no apparent function of the appendix. And as you might or might not know, the appendix can sometimes, it becomes inflamed, and you have to remove the appendix, right? Otherwise it could burst. Okay, so we did that already. Now this is called lymphedema, or some people call it elephanitis, which is a situation where the lymphatic vessels are blocked. And it could block for various reasons. Okay, maybe there is some kind of like tumor growth, or sometimes there are these parasites that can live in the lymphatic vessels and block them, or maybe the valves are damaged. Anyway, a lot of causes. And what happens is you don't have a functioning drainage system, and you're always losing more fluid from the arterial side than you're bringing in. And so these fluid has nowhere to go but to keep on building up in the tissue. And it causes the limb, right, to become super, super big. And as you can imagine, this is very painful, right? The fix is not difficult, but the problem is this kind of condition usually happens in low-income countries where they don't have access to the kind of healthcare that is needed to fix these problems. Right? So a lot of people just have to kind of live with it, even though it's a very debilitating condition. Okay, but that is what happens when your lymphatic vessels are not draining the excess fluid. Okay. So more information on lymph nodes. They are just small little ovoid structures found along lymphatic vessels. Basically, when you have multiple multiple lymphatic vessels coming together, they converge into these lymph node. I think the best way to think about it is to think of it like a like a subway station. Okay, so the subway is just like a tube, but then when you get to the station, it becomes really big, right? And sometimes you have multiple tubes going to the same station, right? Not so much in Toronto. Toronto is like very simple, right? But like in large cities, right? Sometimes you have multiple tubes converging at the same subway station. That's basically like a lymph node, right? And they will filter the lymph, and if there is a pathogen detected in the lymph, the white cell is going to multiply. They're going to increase in cellular activity so that they can fight off the pathogen, right, before it gets out of control. So these are some key locations of where you would find the lymph nodes in the body. Tonsils, we will revisit this later on in lecture 4, but for now there are tonsils that are going to be in the throat area, and that primarily detects pathogen that we accidentally ingest, for example. So like bacteria that causes strep throat, right? That's going to cause your tonsils to become super inflamed. If you ever had strep throat, you would notice orangey, swollen tonsils with little white dots on it, right? And it hurts a lot, right? So the one that is at the back right here, that is the palatine tonsil. That's the one you can see in the mirror. The lingual one, maybe it's a little bit hard to see. Like you're probably gonna gag if you press your tongue down too much before you can see the lingual tonsil. But there's no point of checking that. Okay, usually doctors just look at the palatine tonsil. If that's swollen, probably your lingual one is also swollen. Lingual means tongue, right? Okay, like if you're bilingual, you speak 2 languages, you speak 2 tongues, right? That's what lingual means. And this is the one up the nose. That's the adenoid tonsil. That's the one that gets inflamed and infected when you have a cold, or COVID, for example, right? So this is the nose, and you can see it's quite deep in there, and all the way at the back. That's the adenoid tonsil. So you have 3 pairs of tonsils. Okay, similar function as the lymph node. So there you go. If you go right, that's a thing that dangles at the back of the throat. It's called the uvula. I'll tell you what that does later on. But that's the tonsil. Okay, those are healthy-looking tonsils, right? But when they are infected, they are angry and red and orangey, and it hurts a lot. Okay, so
What's the lighter colored thing down near the tonsil? Is that a stone?
this thing,
Yeah.
I have no idea what that thing is. This probably just some weird tissue thing, but yeah, no idea. All right, the spleen, which is behind your stomach, right, on the left side. Actually, I was pointing at the wrong side, on the left side. And it's not really big, okay? It's like a little bit bigger than your fist, perhaps. Also very similar function as the tonsils, as the lymph node. They screen the lymph for pathogens, but there's an extra function here. It's able to store some blood for you, not a lot, but enough to keep you going for a little longer before help arrives. If you're losing blood, and a person can also live without a spleen, but of course the person will be more susceptible to infection. Okay. Thymus. The size of the thymus is going to shrink as we get older, and that perhaps is one of the reasons why our immunity is not as good when we get older. The T cells that are made in the bone marrow have to go to the thymus to mature, right? And when I say mature, they get activated. We'll talk about how that happens later. But they also have to take a test. The test is called the autoreactivity test. Because of the way T cells are made, and again, we'll talk more about later, there are chances where the T cells that you make will attack your own body. Okay? It's possible to create a T cell that attacks your own cells, and we don't want that. Okay, so we have to check the T cells and make sure that they will not attack your own cells. If they do, we will kill them off before they can come out of the thymus. So that's called the autoreactivity test. Only 5% will be able to make it out. Okay, the rest will react with the body, and they are not supposed to come out. If they end up coming out, then a person could have autoimmune disease. Okay, so things like lupus, things like ALS. These are autoimmune diseases where you have autoreactive cells that are attacking your own body structures. The thymus is also going to be able to make a hormone called thymosin, and that's going to help with the maturation process. Okay, so that's that last bit here. I mean, you probably don't have to memorize too many of these things. Just have the big concept, and then you should be okay. The focus of this lecture is the blood group stuff, and the last bit that we just did in the last 45 minutes. It's just kind of like a connection between the cardiovascular system and the immune system. Okay, so that's it for lecture 2. Any last minute question? Anything from the study guide you want me to take up with you? Now would be a good time to bring it up.
Can we see a similar question as to one that'll be on the quiz? Or
I mean, it's like the poll questions, right? Some of the poll questions are taken from the quiz. Yeah, I mean, I don't have anything with me at the moment, but it should be okay. Like the first quiz is really straightforward. Okay, like take my word for it. If you study, I expect you guys to do okay. My class average for the first quiz is usually in the high 80s. So hopefully that's going to comfort you.
You always go tough later on.
Yeah, that's right. It will get tougher later on. Yes, that's my my signature. Yeah, but I try to let you guys, build a little bit of confidence at the beginning. Okay, now we're gonna move on to immune system. Okay, immune system. All right, so lecture 3. I'll give you a moment to pull up the stuff. I'm gonna go grab my jacket. It's freezing down here. Okay, you go pull up the notes. All right, immune system. Now, I try to keep, because we have 3 units, right? 3 units in the course. I try to have only 1 difficult lecture per unit. And so for unit 1, most people tell me lecture 3 is the hardest one. Okay, I mean, it depends. Like some people find the blood stuff confusing as well with all the Punnett square, but this one is difficult because there's a lot of concepts going on, and I'll try to draw things out for you to help you understand it a little bit better. Okay, but here we go. Immune system. When it comes to immunity, there are 2 branches of immunity. Okay, we have innate immunity. Okay, this is the one that you are born with. Okay, you inherit this immunity, and it works right away. As soon as you come into this world, as soon as the baby is born, the innate immunity is ready to fight. Okay, because think about it. As soon as the baby comes out, there are so many pathogens, right? In the air, people are touching you, even though you wear gloves, right? that's going to have pathogens. So like the immune system has to be up and running, right? We don't have time to develop it. And that immunity, the innate immunity, is not going to change throughout a person's lifetime. Okay, whatever mechanisms means like methods, right? Whatever methods you use to fight off the pathogens as a baby, it will be the same when you're like, 70, 80 years old. An example would be fever. Right? Fever is a mechanism for innate immunity. A baby is able to have a fever. You're able to have a fever in your 30s, in your 80s, right? It doesn't change throughout your lifetime. Okay, you're born with whatever you have, and you will continue to use them in your lifetime. The other kind of immunity is called adaptive immunity. It's adaptive, it's able to adapt because it changes throughout the course of your life. It evolves over a person's lifetime, depending on what kind of pathogens you encounter, in your life. Okay? So your adaptive immunity might be different from mine. Okay, like you might have encountered some disease that I have not, and vice versa. Right, so I would have immunity for that thing, whereas you will not. Okay, you won't get it until you either get vaccinated or you get exposed to it. Right, so it's something that changes over the course of a person's lifetime, and it's not something that you are born with. Like you have to get it. You have to be exposed to the pathogen first before you are able to create immunity for it, right? So that's why adaptive immunity is also known as acquired immunity. Okay, it's adaptive because it can change. It's acquired because you have to get it. You didn't inherit it. All right. I think today we will only have time for innate immunity.
I have a quick question.
Yeah.
So I heard like for babies, you're not supposed to take them out in like public places for the first 3 months. So how does that work with the innate immunity when they're already like kind of ready to go?
Yeah, I heard that before, but like, it really depends on, the parents, right? Like there's no scientific basis to it. As far as I know, like you can take your baby out, like you're just exposing them to possibly other type of airborne stuff. But their body is able to fight it off, right? It's just that you got to be extra careful, right? Like you don't want the baby to catch like COVID or something really nasty, but generally they're quite equipped to deal with stuff, even at the infant stage. But hopefully, when we go through more of these things, then you will understand more of how it works, and maybe we can address this question again towards the end. Okay. So where was I? Yeah, this is an overview of innate immunity. There are different strategies, different mechanisms that can be used to fight off things. Right? So barrier to entries, inflammation, so on and so forth. So I'm going to explain all those to you, and I think I'm going to call it a day after that, okay? Because I know you guys have to prepare for the quiz, and we will just skip the break, and then we'll just go through the whole list. And then I'm going to let you go. And then on Wednesday, we will do the adaptive immunity, and that's the difficult part. Okay, the adaptive immunity is going to take some explaining and understanding. Okay, so let's do the easy part first. So innate immunity, things that we are born with, things that we are equipped with as soon as we are born into this world. First strategy, physical barriers. The best way to fight to defend. Yeah, the best way to defend against a pathogen is not to let them come into the body to begin with, right? And just in case you forgot what a pathogen is, they are basically things that makes you sick, right? Living things that makes you sick. So bacteria, virus, fungus, parasites, right? These are pathogens. Pathogens don't include things like, chemical poison or like cancer. Those are not pathogens, right? So the best way to deal with them is to keep them out. Don't let them come in. That's why we have physical barriers. And skin is really, really important when it comes to forming a physical barrier. That's why when you have a cut, you want to put a Band-Aid on, right? And that's why people who suffer from burns, serious burns, they have to sometimes be put in a sterile environment, because without the skin, airborne pathogens can just land and cause an infection, right? So you want to maintain the intact skin. That's why in winter, especially in Canada, it's really dry, right? Sometimes people have crack in their fingers, and then they have these inflammation around the fingernails, right? That's basically an example of where the physical barrier is broken, and now there are infections going on in the fingers, right? Next one is called mucous membrane. You can't have skin covering all exposed surfaces, okay? So like the inside of your mouth is actually exposed surface, okay? So we don't have like skin, not like skin inside the mouth, which is, you know, functionally it doesn't make sense. So in place of skin, you have these mucous membrane. Okay? So the eyeball has a mucous layer, right? And this continues in the respiratory system, digestive system, reproductive system, and urinary tract. Even though the respiratory system is on the inside of the body, but it's still an exposed surface, right? So, you know, look at my favorite prop again. The tissue paper here, the parts that I'm touching right now, that's like your outside skin. But imagine this is your mouth, okay? So you put the food in, then the food's gonna come out the other side. All the while, all this stuff, even though it's like on the inside of your body, is still exposed to outside material, right? So that needs to have protection as well, and that's where the mucous membrane comes in. You can also have ciliated cells. These are cells with cilia, right? Little hairy structure that moves. And you have them in the upper respiratory tract, right? That could help you sweep up any pathogen that might be trapped, right? The ones that you breathe in and you trap them with the mucus, and the cilia is going to help you move them up, and you know, you can dispose of them. So that's physical barrier. It turns out we have a lot of helpful microorganisms that lives on us as well as in our body. Okay? We have a mutualistic relationship with them. Okay? We give them a place to live, and in turns, they offer us some benefit. Okay? Sometimes they help us make certain nutrients. Sometimes they help us form the physical barrier. These microorganisms, we call them normal flora. Okay? So you will find them on your skin, you will find them in your intestinal linings, and the theory is that they take up so much space in your intestinal lining that there are no more space left for the bad ones to attach to. Okay? And so if the bad ones cannot attach, they cannot establish an infection, and you're good to go, right? That's why sometimes when people take antibiotics, they get a little bit of a stomach upset, right? They may have a bit of diarrhea, because the antibiotics that you take doesn't distinguish between good bacteria and bad bacteria. So, you know, by destroying some of the good bacteria, by destroying some of the normal flora in your intestinal lining, you give opportunity for some of the bad ones to attach to, okay? And that could cause you to have a little bit of an upset stomach. Excuse me. Okay. Now, these normal floras, even though they, you know, live in harmony with us for most of the time, they sometimes can be causing what we call opportunistic infection. Okay, so like if there's a cut in the skin or something, some of these normal flora might actually go and infect you, and they could cause you know, not so serious things, but like annoying things like acne, right? They could cause a little bit of a cellulitis, right? Like I was telling you about the fingertip cracking, and then infecting around the nails, right? So these are like commonly caused by normal flora. And then there is this thing called S. aureus. Okay, S. aureus. We name the bacteria usually, just by shortening the first part of the name to a single letter, like E. coli, right? You heard of E. coli, right? So this is S. aureus. We have S. aureus on our body, but very concerning to healthcare is something called MRSA. You can look that up if you want. When you work in a hospital setting, they are really on the outlook for MRSA. It stands for methicillin resistant S. aureus. Okay, so these are multi-drug resistant S. aureus. And from last semester, I told you, if one bacteria is resistant to a set of antibiotics, it could transfer these resistance to other bacteria, right, through the plasmid exchange. So on our body, we have the regular S. aureus that's not going to be causing too much problem. But if somehow come in contact with the MRSA strain, then it could convert those, right, on our body. And if they cause infection, then we have very limited treatment options. Okay. So physical barrier, we have the intact skin, the mucous membrane, ciliated cells, as well as these normal floras. Okay, you can get the normal floras back if you take antibiotics and you killed off a bunch of them. It's okay, they will come back. For some people, what can you eat to bring back the normal flora in the gut? Like if you have a really bad episode of like food poisoning or something like that, that really rid off of your normal flora, what can you take to bring them back quicker?
Excuse me, sir.
What is it? Sorry?
These normal florals, are they normal to be in the body? Or
Yes, they are.
don't-
They are like healthy bacteria that is in the body. Yeah, in the body. So my question is, what can you take? It's something that you can buy at the just the supermarket.
Banana?
Did you say banana?
Yeah.
Not what I have in mind, but anyone else?
Electrolytes?
Electrolytes will replenish your like ions, like Na plus and K plus. Anyone
Yogurt?
else? Yogurt, that's right. Yogurt, yeah, the yogurt, right? But not just any kind of yogurt, right? The one that has like probiotics, right? Okay. So sometimes you can get probiotic drop as well, which contains, they say, billions of good bacteria, right? Probiotic. You have heard of this, right? So that's going to replenish the normal flora. I mean, even if you use the sanitizer a lot, right? Like you're killing off good bacteria on your skin, but they will come back. They will come back. Okay. So using sanitizer is good, but some people say, if you use it excessively, then it might be counterproductive, because not only are you like killing off the good ones, but you're also like drying up your skin with all those alcohol, right? And when the skin is dry, they crack easily in the winter, and that could give opportunity for bacteria to start infecting your body. Okay, so then we have the yeah.
So I have a question.
Yep.
So this Staphylococcus is not really a bad bacteria.
Which one?
This Staphylococcus.
The Staphylococcus?
Yes.
Oh, yeah, okay. So Staphylococcus is a family of bacteria, right? Okay.
Okay.
Staphylo just mean like a chain. The coccus means a ball. So these are bacteria that lives in the chains of ball-shaped bacteria, okay? So this S. aureus, that one is okay. It doesn't cause, serious infection. Right? But there are other Staphylococcus, right? Like strep throat. Right? That one can cause quite a bit of problem, right?
Okay, because back home, people who sell herbal medicine, they make it look like the Staphylococcus is a very bad disease or infection.
No, yeah, it is, right? It depends, again, right? Depends. Staph is like a whole family, but then
Yes.
depending which one, right? Yeah.
Okay.
Mhm.
Thank you.
Good question. Where am I? Okay, so like besides physical barrier, we also have chemical barrier. So chemical barrier usually has some kind of secretion to it. All right, that's how you distinguish it from physical. So we have things like lysozyme, which are antibacterial enzymes. Okay, you will find them in sweat, saliva, and tears. Okay, so a lot of stuff on the eyeballs. You know, people rub their eyes a lot, they can get an eye infection, right? But you know, just by opening your eyes, things can land on the eyeball, and you want to kill off the pathogens. So that's why there is some like lysozyme there, right? Same thing with the sweat and the saliva. We also try to maintain low pH in certain areas of the body. Low pH is going to help inhibit the growth of many different types of bacteria or fungus. An example of low pH environment would be in the stomach. Okay? The pH in the stomach is only about 1 to 2, very, very acidic. And in the vagina as well, it is slightly acidic to prevent, again, bacterial or fungal growth. Okay, so that was the first mechanism, all right, keeping things out, physical and chemical barrier. If those things fail, and the bacteria, I keep on saying bacteria, but it's true for all pathogens, right? Okay, but most people is able to visualize the bacteria easier. So that's why I keep on saying bacteria. So if the bacteria breach the physical barrier or the chemical barrier fails to keep them out, now they're in the body, and we try to get rid of it before it establish a serious infection, right? And so the second method for innate immunity is inflammation. To make sure that you don't fall asleep from listening to me too much, we're gonna switch and write a note for inflammation instead of looking at the PowerPoint. So this here is a new note. Oops. This here is a new note. It is inflammation. Okay. So the cause of inflammation is created by this cell called the mast cell. Okay, mast cell. We have not looked at that before, but it's very similar to basophil. Okay. Instead of circulating in the blood, mast cells are anchored to tissue. Okay, so they're not moving around. They are like stuck in one place. And what happens is, in an infection, mast cells release histamine. Okay? And that is the stuff that is responsible for causing the inflammation. Okay? Histamine. What do you take when you have an allergic reaction?
Benadryl?
Yes, and what's the active ingredient in things like Benadryl? What?
Antihistamine.
That's right, antihistamine. Right. So histamine causes inflammation, and inflammation is related to allergies. So antihistamine suppresses these symptoms. Okay, so let's take a look at what the histamine will do. Okay, two effects on blood vessels. Oh, sorry. Before that, I have another thing I want to write. Okay. The purpose of inflammation. Okay. Why do we want an inflammation? Well, believe it or not, the purpose of inflammation is to recruit more white blood cells and plasma protein to the site of infection. All right. We want to bring more white cells here to help clear the pathogens, and we want to bring more plasma protein to begin the healing process. Okay, and as you will see, some plasma protein is also capable of fighting off infection as well. Okay, so that's the purpose of inflammation. Even though inflammation hurts and it's not a pleasant thing to experience, the underlying purpose is to help clear the infection by bringing more white cells and more plasma protein to the site of infection.
I have a question.
Yeah.
So, like, there's this kind of inflammation, then like when you break a bone or like hit something, that also like
That's right.
inflames.
That's right.
Is there a
Exactly.
difference? Or
Yeah, basically the inflammation is brought on by tissue damage, okay, or by having the pathogen in your system. Yeah, but in terms of the outcome, it's very similar. So like, cutting your finger, that's going to trigger inflammation, right? Okay, but you can also have inflammation without any apparent cut. Okay, you can just have pathogens that have, entered the body through other means other than a cut, and that could cause inflammation as well. Okay, so the effect of histamine, right? The histamines are released by the mast cell, and the first effect is vasodilation, which means the blood vessels diameter increases. And then what does that do? It increases blood flow. Okay, which totally makes sense if you think about it, right? Why? I mean, if we're trying to bring more white cells and plasma protein, then we want the blood flow to increase. We want more blood to be floating to the infected area. And to do that, we need to make the blood vessels bigger. Okay, so increase blood flow. But then there are some unwanted side effects. Okay, because we have more blood flowing, the side effect of that, well, not side effect, but then like, yeah, let's just call them side effects. The side effects are warmth. Okay, because with more blood flow, it's gonna bring heat, right? So warmth and redness. Redness. Okay, so both warmth and redness are caused by the increased blood flow. Now, we have increased the diameter, more blood is coming, it's bringing more white cells, it's bringing more protein, but it's not gonna be useful if these white cells and proteins cannot exit the blood vessels, right? Remember, capillaries are leaky, but typically the pores are not big enough for the proteins to come out, right? And the white cells have to squeeze themselves out. So to make it easier for these things to get out of the blood vessels and start fighting off the pathogen in the tissue, you need to make it more leaky. So the second effect of histamine is it will increase permeability. Okay, of blood vessel. Right, so what does this do? It allows WBCs and plasma protein to enter infected tissue quicker. Right? Now, what do you think the side effects of that is gonna be? If you have all these things leaking out, what's it gonna do to your tissue? It's something that we learned earlier.
Swelling.
That's right. So swelling. And with all the swelling, you're gonna experience a little bit of what?
Pain.
Pain, that's right. All these extra fluid is pressing on your nerve endings and it's hurting. There's a very characteristic pain that is associated with inflammation. Again, if you ever cut your finger, or I remember one time like someone closes the car door while my hand is there, and then like it slam on it and it becomes like super inflamed, right? So the pain associated with that kind of inflammation is very distinct. It's like a throbbing pain. Right? Like when you try to sleep at night with the inflamed fingers, the finger is pulsating, right? Keeps you awake. Right? So that kind of pulsating pain comes from the extra fluid that has been leaking out. All right, so these things, these side effects, these are called the hallmarks or the characteristics of inflammation. Okay. If a body part is experiencing all these things, then it's undergoing inflammation. Okay. But that's not the purpose, right? The purpose is to bring more white cells, bring more plasma protein. But in the process of doing so, we caused all these unwanted results.
But when we take medicine, will it not reverse it?
Yeah. Sometimes we, if the inflammation is really out of control, then you can take a little bit of like, say it's in a finger, right? Then you can put some cortisone, right, which is basically steroid. Steroid dampens the inflammation. Right? Sometimes if the inflammation is really systemic, as we will see, like for people who suffer severe reaction with like peanut butter or something like that, right? Then you need to inject the epinephrine, right, using the EpiPen. That will reverse some of these. Otherwise, it could be life-threatening, right? But generally, a little bit of inflammation is just your body's way of trying to, contain the infection before it gets out of control. Mhm.
How does ice keep the swelling down? 'Cause, like you put ice on it kind of thing.
Yeah, so the ice is basically counteracting. Okay, so like when it's really cold, what does your blood vessel do? Do you know?
It constricts.
Yeah, exactly, right? Because like if you're outside and it's cold, the blood vessel actually try to constrict and it tries to bury themselves deeper, right? So it doesn't lose as much heat. So that's what the ice is doing. The ice is basically counteracting the vasodilation, right? And if you reduce the blood flow, then it will help reduce the swelling as well. Okay. All right. That is that. There we go. This is a picture of a mast cell, and all these things here, that's the pockets of histamine. Okay, and here all these arrows are pointing at a mast cell. You just have to believe me. And then this here is a vessel, is a blood vessel. So when they release the histamine, they would affect the blood vessels that are nearby. That's why this is a localized event. Okay, localized event. If you cut the finger, only the finger will have inflammation. Okay, not the whole body. When we talk about the peanut butter overreactivity, that's the whole body. Right? And that is a different situation. All right. Which of the following is an example of physical barrier? Fantastic. Most of you got it right. It is, of course, the ciliated cells. Everything else are chemical barriers. Next, which of the following occurs after the release of histamine? Okay. Localized swelling is correct. B looks correct, but it's actually the other way around. The white blood cells the statement here says white blood cells enters from tissue into the bloodstream is the other way around. You want them to go from the bloodstream to the tissue, right? Because where's the infection? Is the infection in the tissue or in the blood, right? In the tissue, right? So they have to exit. So that's why B is wrong. It's the other way around. Okay, so sometimes you gotta be careful on the quiz. Make sure you read the statement carefully. Okay. So we talked about the physical barrier and the chemical barriers. We talked about inflammation, okay, to try to contain the infection. And as you are doing this inflammation, there are other things that are going on simultaneously. Okay, so the third strategy that innate immunity use is phagocytosis. This is not the first time you hear about phagocytosis, right? We learned it last semester. This is cell eating. Phagocytosis is the ability to eat up another cell, right? To eat up things that are not supposed to be there. So we have two kinds of cells that are capable of doing phagocytosis. We will learn two. That's what I mean. Okay, we already know from last lecture neutrophils, right? The most common type of white cells, right? Makes up 70% of all your white cells. They are capable of phagocytosis. They will eat up whatever is not supposed to be there. Macrophage is another kind of phagocyte. If you think back the note that we took, macrophage was not always macrophage. They were monocyte first, and then they're able to change into macrophage when they encounter pathogen. Okay, so how do they know what to eat? They eat anything that has what we call PAMs on it. Okay, PAMs. So PAM stands for pathogen associated molecular patterns. Okay, so these are a group of molecules that can be found on pathogens. Okay? And if the white cell sees these particular molecular patterns, they know that is not supposed to be in the body, and then they will go and eat them up. Okay, so in this picture, we have a phagocyte here. Okay, and this thing has PAMs on the surface. Okay, they will just eat them up. If you're a little bit confused about what PAMs are, they are like warning signs that are on the surface of the cell. Okay, and these are warning signs that your white cells are born to recognize. Okay, it's encoded in your DNA. Okay, so think of like as a loose analogy, right? Like if you see something with the do you guys learn witness in chemistry class? Do you know what I mean when I say witness? Did you learn this? Like the symbols, right?
Yeah.
Yeah. Right. So those are the symbols that you are trained to recognize as dangerous, right? Like you see the skeleton, you know not to drink that stuff. Okay. You see the exploding symbol, you know not to put that over the fire. It's dangerous, right? So in the same way, your white cells are trained to recognize certain patterns, certain symbols. Okay. And if you see those symbols on a particular cell, you know that cell is dangerous. You need to kill it. That's basically what PAMs are. Okay, they are like the witness symbol, but on a molecular level. Okay. Now, when the phagocytes encounter these things with PAMs on them, they have to call for backup. Okay? The neutrophils are like, we cannot deal with this alone, and the macrophage will help call for reinforcement. To do that, they release this thing called the colony stimulating factors. These stimulating factors will go to the bone marrow and it will crank up the white cell production. Okay, so you end up making more. Okay, and then they will go to the site of infection and help fight it off. But how do they know where to go? I will have to explain that later on. As the infection is being overcome, that's the best case scenario. Okay, you're able to fight it off. As the phagocytes are eating up, mopping up all these pathogens, right? The pathogens die, of course, but the phagocytes also die. Right? And all these dead white cells and dead bacteria, sometimes even the living bacteria, they all become like this mixture of whitish stuff. That's the pus. Okay. So having a bit of pus indicates the body is actually, clearing the infection. But sometimes the pus, they build up too much and they kind of interfere with the healing process. Okay. And that's why, like, you might have to drain the pus sometimes if it's really, really serious. You shouldn't really pop it yourself, right? Like that's what they keep on telling you. And if you do pop it, you probably should put some, antibiotic ointment on it or something. But sometimes the pus is really building up in a body cavity. We call that an abscess. Then you have to drain it at the hospital, right? Okay, so this is a very good summary picture that you should read through on your own. Right? We have the splinter coming in, introducing these, bacteria, the green ones, and then you have the mast cell here releasing the histamine, which would then cause the blood vessels to expand and become more permeable. And we have the neutrophil here. We have the macrophage here trying to eat up as many of the green bacteria as possible. And then there you're going to be releasing some colony stimulating factor, which would go to the bone marrow and cause you to make more of it, right? And here you have blood clotting going on to start to repair the wound. It's just a really good slide to read through on your own and try to see how everything is connected. All right, I'm just going to do one more slide and then that will be it for today. Working along with the phagocytes are these things called natural killer cells. That's actually what they're called, okay? Natural killer cell, NK cells. NK cells, instead of targeting bacteria, right, like the phagocytes do, they target virus-infected cells as well as tumor cells, okay? So just a quick recap of how viruses work. There is a whole cell. Doesn't have to be a bacteria. It could be like your cells, okay? And then there's a virus. The virus will inject its genetic material, and the virus basically hijack the cell machinery to make viral proteins, right? It will hijack your ribosomes and so on and so forth, and then it makes all these viral particles, which will assemble into functioning viruses, and then the cell bursts open, and you have all these viruses coming out, and then it will infect more cells, right? So that's how it works. The thing is, when a cell is infected with a virus, it actually put kind of like distress signals on its cell membrane. It's telling your immune system, hey, I am infected with a virus, okay, please come kill me before all these viruses burst out of me. Okay? It's like, watching a zombie movie, right? Someone's best friend got bitten, and then they are saying, oh, you got to kill me before I turn into the zombie. That's basically what the cell is doing, okay? And so the natural killer cell will be able to pick up these distress signal of a virus-infected cell, and it will destroy them, okay? On the other hand, tumor cells, which is a little bit harder to detect, they are not pathogens. They are your own cells that have mutated, right? We learned that last semester, with the oncogene and so on and so forth. But there are some subtle changes on their surface that the NK cell might be able to pick up, okay? So, when the NK cells are able to clear these tumor cells at the early stage, then our body remains cancer-free, right? But they don't do a perfect job all the time, and as a result, cancer still exists. Okay. So that is it for today. We learned 3 out of the 5 strategies involved in innate immunity, right? Physical and chemical barriers to keep things out. When they do get in, we try to contain it with inflammation. We try to clear it with the phagocytes and the NK cells. Okay. Next class, we will learn the remaining strategy, as well as what happens if innate immunity fails, right? Then we have to bring in the big guns, right? The adaptive immunity. Okay, thank you for coming. Good luck with the quiz. You have until tonight to access it. If you run into any problem, just email me. We'll try to get it sorted out. Okay.
Thank you so
Okay, have a good one, guys. Bye for now.